All right, everyone. Welcome back to Paging America. Thank you for joining us for an In Case You Missed It breaking healthcare news. We just had some sort of shocking developments in the Trump administration, putting Obamacare back on the table. A fight that we thought was long dead and gone is coming and rearing its ugly head as the shadow of the shutdown is sort of creeping up on us. So Rob and I are jumping on. We barely had time to comb our hair just to make sure that we can react quickly. Well, let me just speak for me, Rob.
Okay.
So we could react quickly and bring to you the most important parts of what the president's saying about sort of major healthcare policy. So you don't have to listen to the whole thing. So why don't we throw to the first clip and then we can dissect it.
And this is going to have a huge impact. You know, as I said, Obamacare is not a good thing. It's been bad, and I'd like to make it better. I told them. I spoke to a lot of people, a lot of Democrats recently. I said, why don't we change it? We can make Obamacare much better. We could come up with a new system that would be much better, less expensive for the people and better. This is maybe the biggest breakthrough.
The greatest hits of Trump version 1. I mean, I thought,
Yeah.
I mean, the last time he tried to do this, his famous quote was, "Nobody ever knew healthcare was so complex,
Complicated,
right? Whatever
right.
he said." And like, Jesus, an older, more addled Trump now claiming they're going to do something better. Like, what is it? Does anyone know what the fuck he's talking about? Like, really?
No. No, it'd be interesting if any Democrats come forward and say he actually has a proposal to make it better. I would suspect that he does not. The things that they're proposing, major healthcare changes, including like expanding Medicare Advantage, makes healthcare worse for older folks.
Yeah. Privatize Medicare for old people, right? Privatize Medicare for older people.
So for the things with any layer of details on the table right now are just wholesale worse for consumers. And it's really hard to understand without any details what they would do to Obamacare to make it cheaper for folks, particularly since the major thing they're arguing about in the lead up to the shutdown is making Obamacare plans more expensive.
More expensive, right? They don't want to extend the tax credits that make people's healthcare less expensive. We already know there's like, what, 18%, 20% increases in premiums pretty much across the board, irrespective of tax credits, right? Just kind of coming in. So now if they get rid of these, we're talking in some people's cases, 75% increase in premiums for some people. And they are resisting that. Republicans are specifically resisting that. Democrats want that. So it's all bullshit, right? It's Trump riffing. It's Trump like having a microphone and not knowing what the fuck to say, like I said, a men of sin or whatever the hell he tried to do a week ago. It's him riffing and him going back to his greatest hits of attacking Obamacare because he hates Obama and he has nothing else he can do.
I worry. I'll tell you, I'm going to go to a very dark place, Rob, is like the Trump administration, the officials around him, and certainly the Republican leadership know very well that putting Obamacare back on board in terms of something that's being debated is politically catastrophic. It is one of the major reasons for the Republican wipeout in 2018. We thought everyone learned the lesson. It was such a dirty beating at the ballot box that it seemed like the conversation was dead and gone, and we were never going to have it again. I mean, they were going to go after around the edges, but like going like a full frontal assault against Obamacare was not on the table because it is so politically catastrophic, because so many people rely on it, and because it is so popular as it has become a cornerstone of the entire American healthcare system.
Yeah.
So the dark place is that seems like a person who's not particularly interested in having free and fair elections again, right? Because you're not re-litigating something that is such a surefire loser.
Yeah.
I don't know. Maybe, but so that was his comment on Obamacare, but he had an additional rambling thought that I think we want to pick apart about the shutdown, because I think there's something important in there, but we're gonna have to sort of tease it out because of the way that he went around saying it. Why don't we throw to that clip?
I told you we have $17 trillion being invested. So the last person that wants it shut down is us. Now, with that being said, we can do things during the shutdown that are irreversible, that are bad for them and irreversible by them, like cutting vast numbers of people out, cutting things that they like, cutting programs that they like. And you all know Russell Vought. He's become very popular recently because he can trim the budget to a level that you couldn't do any other way. So they're taking a risk by having a shutdown because of the shutdown, we can do things medically and other ways, including benefits. We can cut large numbers of people out. We don't want to do that, but...
Wow. So Russell Vought, right? That's how you pronounce it. Like, this is Project 2025 architect, OMB guy, Russell Vought, who's taking a hatchet to the budget wherever he can, right? Trimming with a big old hatchet.
What did he mean by we could do it medically?
Yeah, I don't know if he's talking about medical procedures. Like, I don't know.
I think he was like,
so.
we could take a scalpel. Like he got like the metaphor we could like use the scalpel or the...
Yeah, but really what he's talking about when they're talking about trimming benefits is cutting healthcare, right? Like, do it medically.
He's talking healthcare or SNAP
taking away healthcare.
Other social programs. So...
And the very detached way that he discusses this, cutting programs they like, or like, who are they, right? For him, they are his opposition, right? Democrats in Congress, right? For everyone else, they is anyone listening to this. They are the people who depend upon, Affordable Care Act, depend upon Medicaid, depend upon Medicare. They are the people he's talking about when he said programs they like, because they are just simply the American people who depend upon a system that is imperfect, to be sure, and needs to be better. And we want to make it better. But this guy's talking about taking away benefits from people, something he says is a threat he's putting out there.
It's an incredible, it's like hard to negotiate with a hostage taker. And we don't even know what the policies are because the guy can't speak with any specificity at all in any context, it seems like. So it's vague on purpose. But he's holding a hostage on some unnamed, enumerated number of social programs in order to not have to have an important conversation about ACA subsidies and the extension and not having catastrophic healthcare premium increases. So we'll find out what he's holding. If he's going to hold a bunch of hostages, we'll find out who the hostages are, what the hostages are. But we just know that today what we know is that he's willing to take hostages.
He is willing to, and he's already proven, right? He and the Republicans in Congress have proven they've already been willing to cut tens of millions of people off of healthcare with their big bill that they passed a few months ago. So, what the hell do they care about another 10 million or so? I guess stay tuned. We'll see who the hostages are. He's certainly telegraphing something to us.
Hey, what? Just as an aside, and this isn't nearly as important as the subject matter at hand, but why are these guys being used as props in the background? Like they have jobs. They spend the last 7, 8, 9 days, they've spent so much time standing on either side like an angel and devil on Trump's shoulder. Like behind him at press conferences. Right? It was like an incredible amount of their time.
Just getting some airtime and like showing support for their rambling idiot of a president.
Wow. What a wild thing. So, okay, I don't know, Rob, what comes next now? We are on shutdown doorstep. Where do we go from here? What do we think the Democrats are going to do? We think they're going to stand up for the ACA costs, or does this seem like a threat that might work?
No, I think they got to stand up. I mean, if you back down to the bully will just keep bullying you, right?
Yeah.
And if his bullying tactics are taking healthcare away from everyday Americans, and if Democrats want to be the party of the people, right, standing for everyday Americans, they can't back down when this guy threatens that he's going to, some unknown threat, right? They can't. I don't think they can fold. I think you're the political expert on this reaction. What do you think? I
don't think they can fold. I think they've put themselves in a situation where they can't fold to this, and I do think. I mean, Vought's going to shoot hostage. This is going to be like pain on either side, but like having him continue to barrel forward, turning the government into a personal profit apparatus, and while cutting people off healthcare or having a fight now, something's got to give one way or another. I say Democrats have the fight,
Have the fight.
Yeah. All right. This has been in case you missed it, breaking healthcare news. We're going to be coming back with these as big developments happen, so you don't have to monitor the news all day long. It is tedious. It is painful. But we'll be sharing these with you guys as we see developments that we think are important. This one obviously was a big development for today. We'll see what happens as the shutdown moves along.